spent some time with Joe Piscatella at a cabin near his office in Washington State. I met him at a conference sponsored by Sally Hass. Let's hear Joe's fascinating story.
I got into it the hard way by going through bypass surgery at the age of 32. I didn't think anything was wrong. I thought I'd been living the same kind of a lifestyle as everybody else in the United States. But one day I played tennis and I got a little pulling sensation in the middle of my chest. Well, I thought that can't be anything, and I went back and played the next day and the next day, and the little pain wouldn't go away, and it kept getting a little more intense. So I saw my family physician, who immediately ran me over to see the cardiologist, and my goodness, 2 days later I was in bypass surgery for a 95% blockage. So I thought after I came out of the surgery, I better figure out how to live better and certainly change my diet. So I saw a national expert, a physician, and asked him the question, should I be changing my diet? And his response to me was, don't bother. You're 32 years old, you have aggressive coronary disease. I doubt that you're going to live to be 40. If you think you're going to see those children in the waiting room graduate from high school, that isn't going to happen. So I went home very discouraged and kind of moped around a couple of weeks, and then my wife finally yanked on my chain and said, let's get something straight. You cannot change the cards that you were dealt. You're 32 years old, you have aggressive coronary disease, those are facts. But we can change the way, despite what that doctor advised, we can change the way that we play those cards. And that's what we're going to do. We're going to eat better, we're going to exercise effectively, we're going to manage our stress better. We're going to put together a lifestyle package to try to even up the odds. And that's exactly what we've done. And I'm very pleased to tell you that this year marks the 30th anniversary of my bypass surgery. I'm well past the age of 40. I have seen my children graduate from every school they've been to. I've lived a long time past what the doctor predicted, and I'm just getting started.
Joe turned his experience into a passion for helping people live well. He wrote 2 books and conducts seminars and workshops that help us make healthy choices.
There's really a ton of research having to do with the impact of lifestyle on health, and particularly cardiovascular health. We used to think that this was all genetic, and every time we get a physical, the doctor would say, did your father have a heart attack? Did your grandfather have a heart attack? Looking for that genetic connection, the bad genes in some families. And frankly, for some families, that explains why they have heart disease. Today we know that for some folks, that explains it. But we also know that there aren't very many of those people. That if you look at 100,000 families with heart disease, about 8% of those families have it primarily because of bad genes. 92% of them have heart disease because of knives and forks, because they smoke, because they don't exercise, because they're under chronic stress. This is a culturally induced problem in the United States. Understand this, of the 6 billion people that walk the face of the earth, 5 billion do not know how to spell cholesterol, which means that we can live a lifestyle that either bolsters heart disease or we can live a lifestyle that actually will prevent it, manage it, and maybe even reverse it.